Hi, it's Russ from the Training Institute. Today I'm going to talk about personality disorders. The first thing to do is consider, what is personality? It's the kind of people we are. It's the kind of person you are. Are you easygoing? Are you flexible? Are you funny? This is our personality, right? It's to do with your temperament, your moods, your sensitivities, how adaptable you are, how resilient you are. Crucially, your personality also includes how you cope with difficult situations, how you cope with stress, and how you problem solve. Are you reactive? Are you thoughtful? Are you calm? All of these elements make up our personality. So before you can consider that a person might have a personality disorder, it's worth pondering, what's a typical personality? What would be considered in the normal range? A phrase we use now is neurotypical. I think where we have to start is a neurotypical personality is when a person has the capacity to function independently, autonomously, if you like. They can generally adjust to circumstances, and crucially, they can figure out how to behave in different circumstances, different environments, and different contexts. What you're going to see is that people with a personality disorder, they really struggle with that, and they tend to have a set way of being that isn't very adaptable, and it puts them into trouble in different contexts, in different kinds of contexts. I do want to make a tiny disclaimer there. That view of personality is pretty much a Western view, but I'm going to stick with it for now as we proceed. So one thing I'm going to encourage you to do, if you've not looked at it, is a personality portfolio or test that is really commonly used in psychology and very well accepted. It's often referred to as the Big Five, and it's 5 characteristics that everybody has on little continua. And the way I like to remember it is the word ocean. Okay, so it's an acronym. The O stands for openness, how open you are to new experiences. The C is conscientiousness. What's your level of conscientiousness? E is your level of extroversion. A is how agreeable you are, and N is your level of neuroticism. And I want you to think about them on continua, okay? So it's not like a person is open or not, it's how open, okay? And so as we start to think about personality, it's kind of fun to think about where you land on those different 5 continua. So let's keep going here into personality disorder. And I like to just sort of pause on that point and sort of remember, my personality is really who I am, right? And for someone to diagnose me or label me with having a disorder of my personality is a very big thing for someone to do diagnostically and clinically. So personality disorders are not diagnosed lightly, and they're generally not diagnosed in children because their personality isn't formed. But how we want to think of a personality disorder is, and this is a definition, it's an enduring pattern of inner experience and behavior that deviates markedly from the expectations of that person's culture. And it's pervasive and it's inflexible. All right, so it's a very stable condition over time. It doesn't tend to move around a whole lot. And then crucially, it leads to distress or impairment. And that's a key element, because otherwise you could say to yourself, oh, this person has a different kind of personality. Who cares? Well, it leads to distress and impairment, and that's the key element. And now I just want to come back to the word culture, because I kind of sneaked that in there, and that's a big word to just have it appear. You can see that a clinician, when assessing and thinking about a person's personality profile and portfolio of symptoms, has to do something quite complicated and ask themselves, okay, but to what extent is this set of behaviors quote unquote normal in the person's culture? So if someone's from a different culture, that can be a very difficult diagnostic question. Nevertheless, that's how it's organized in the Diagnostic and Statistical Manual. So it's a pattern, and you're going to hear that word a lot from now on. All right. So what we see are these patterns of inner experience, these patterns of behaviors, these patterns of emotional, sometimes outbursts, and they lead to impairment, because unfortunately what happens is they upset other people, okay? So it's other people's responses to these patterns that create the impairment. Perhaps we could say at this juncture, personality disorders are really extreme configurations of normal personality traits. Okay, so to some extent, everyone is a little bit conscientious. Okay, but if you're on the very extreme ends of those continua that I talked about, then you have the potential to veer outside of a cultural norm, putting you at risk for a personality disorder. Okay, one of the slightly more sophisticated way of thinking about it is to use the idea of ego. Okay, and if you think of when I wake up in the morning, right, I'm not surprised at how I am. Okay, so we think of some types of clinical disorders. Depression would be an example, as what's called ego dystonic. And that means I actually am a little surprised at how I feel. So you hear people say, gosh, this isn't like me. Right? I'm normally feeling more enthused about what I'm doing, but today I'm really down. Or this isn't like me. I'm feeling really anxious about doing this presentation, and normally it's no big deal. So that's incongruent, okay? That's an ego dystonic situation. Now, clinical disorders like anxiety, depression, they're like that. Now, personality disorders are not like that. They're called ego syntonic, which means when I wake up in the morning, I am not surprised about how I feel, how I react to the world, what my behaviors are, what my inner experience is. And this is where personality disorders lives. And the reason I bring this up is because there's very often quite a lot of resistance from the person, because they don't feel like there's really anything wrong with them. It's just how they are, right? So that's going to be difficult when that person is in a clinical setting, when they're in groups, when they're doing therapy, when they're getting counseling. It's just the way they are. And, you know, how could you say that there's something wrong with how I am, okay? So keep that in mind, that ego syntonic disorders, which makes them a little tricky. Now, I'm going to go through a list of different personality disorders as organized in the DSM. But before I do that, I just want to mention, because you might be thinking, gosh, Russ, what causes someone to have a personality disorder? That would be a good question, but it's not a clear answer. In fact, there's considerable disagreement about what potentially would cause someone to grow up with a disordered personality. But it seems like it's a complex mix of different factors. Environment, where you grow up, how you were parented, your social circumstances, your early life experiences seem to be very, very important. The role of trauma has been getting a lot of attention, and then genetic factors too. For now, thinking of it as a complex mix of causes is probably the most useful way to answer that question. Okay, so I would like now to go through the personality disorders, and you can see from the chart that there are 10. Okay, so they're organized in 3 columns in the Diagnostic and Statistical Manual, and they're called clusters. So there's 3 clusters, cluster A, and these are clustered together because the behaviors here seem a little off, a little odd, unusual, or eccentric. Cluster B, this is the group that gets the most attention. These are the dramatic behaviors that everybody really notices, and typically this is the group that shows up in mental health programming, by the way. And then there's cluster C. These are more anxious, grouping them together. So if you would, I'd like to just go through them a little bit and highlight a few things so we can get our arms around this actually very enormous topic. So cluster A includes 3 different personality disorders. And oh, by the way, there's nothing that says you can't have 2 or even 3 personality disorders, and a depressive disorder, and a substance use disorder. It's complicated right from the off here, but if we stick with one for now, let's start with paranoid. Most people understand the word paranoia. A paranoid personality disorder is, and here's that key word, a pattern of distrust, a pattern of suspiciousness. And what people with this way of thinking, this way of being in the world do is that they look outward at the world as like, I'm kind of on my own, and the world out there is very dangerous. All right, so I can't trust people. They often take on an identity as a kind of victim. You know, people have wronged me, and therefore my way of being is to be super protective. So it's nice to think of like, well, okay, this way of being must have some sort of strength and also weaknesses. And in this case, the strength would be they can be very resourceful. They're very aware and protective of themselves. Their deficit is clearly trust. So they have great difficulty being with other people, forming lasting relationships. And unfortunately, one pattern of behavior is they are retaliatory with other people. The next one in the cluster A is schizoid. Here, the pattern is it's a kind of detachment. People with this type of personality are really not interested in social relationships. And by the way, it's not a problem for them, right? So you might think, well, that poor person hasn't got a lot of social, engagement. That must be terrible. But for them, it's no problem at all. They don't look for it. They don't want it. And in schizoid personalities, there's a very restricted range of emotional expression and affect. So they seem flat. Their fundamental pattern is just detachment. And you might think, well, what's wrong with that? Maybe nothing. Actually, there may be many people with this personality type that just don't really engage with other people, and we don't notice them because they don't want us to. Their view of themselves is kind of interesting. They would see themselves as very self-sufficient, and their deficit, however, is that they have difficulty attaching. They tend to push people away. Maybe it's someone who, I don't know, could be living off the grid in the woods. That's kind of where my brain goes. And by the way, if you listen to that and you think, well, what's wrong with that? Then that's a good thought, I think. You know, this is a very Western way of thinking about personality, to consider neurotypical and then deviations from it as some sort of deficit. So I want to acknowledge that. The other cluster A is schizotypal or typal personality. And this is similar. There's a relationship here with schizophrenia, but it's not quite the same thing. It's a lot of odd behaviors, very eccentric. The pattern is someone who really does very unusual and odd behaviors. Usually very uncomfortable in relationships. But interestingly, this group think of themselves as kind of gifted. They often think that they've got answers in the universe that other people just don't understand. So they deal with the world by being eccentric, having grandiose ideas, making incredible plans, and they can be very, very creative, incredibly creative. But their deficit is conformity. They have real difficulty conforming to social norms and being in society. So that's what cluster A all have that eccentric sort of sense about them, and that's why psychiatry in its current form puts them together. The second cluster, now these are ones you're going to hear about. These are clients you're going to meet. And again, I want to remind you, just because you have one doesn't mean you can't have another. But here we see antisocial, borderline, histrionic, and narcissistic. So let's quickly go through those. Antisocial, we know what that means. That's not a difficult concept. The pattern is a complete disregard for and violation of the rights of others. Their view of the world is, it's a dog-eat-dog world out there. You have to fight for what you can get. And the view is, I'm superior, I'm going to get what I want. The way they deal with the world is, we might call it exploitative opportunism. Okay, so interestingly, people diagnosed with antisocial personality disorder can be kind of charming. But of course, they do that as a strategy to achieve an end, which is to get what they need. So their strength is they're very independent. Like I said, sometimes very charming and agreeable. Their deficit is they lack integrity, they lack honor, they're completely untrustworthy, and they make a lot of trouble for the people around them. The next one is borderline personality disorder, and we do another video just on borderline because this one gets a lot of attention. At least 20% of psychiatric intakes are people with borderline personality disorder or symptoms related to the disorder. This one, the pattern, okay, you keep hearing that word, so that's what you'd be looking for. It's to do with instability. Like nothing is stable. Their relationships are not stable. Their self-image is not stable. Their emotions are unstable. And they're very impulsive. So nothing. So when you're around someone with a borderline personality organization in their mind, you kind of don't know really what they're going to do. You don't know how they're going to react or how they're going to be. They can be very charming and happy one day and utterly different the next. So you're sort of not sure how to be around them, and that's what creates the incongruence, the problem of relational work. What they do is they see themselves as very vulnerable, right? And kind of sometimes it's a bit sad, sometimes almost worthless. And they view other people as either very, very amazing, like kind of amazing, or terrible. So they do a lot of all or nothing thinking. That's a characteristic of borderline. You're either with me or you're against me. You're either an incredible therapist or you're the very worst ever. And so that's difficult to deal with. And so these folks, unfortunately, get a lot of attention in the mental health field. It sometimes seems like people with borderline personality seek chaos, and we'll speak more about that in our borderline video. Histrionic, the pattern here is excessive emotionality, and it feels like they're constantly seeking attention. Emotional coerciveness. This is the person at a funeral that's crying uncontrollably, and it almost makes you wonder if they're trying to make the event about them rather than the deceased and their family, which is outside of the norm of social behavior and personality, putting it at that disorder level. Their great strength is they have high self-esteem, incredibly, and they can be really charming, they can be really extrovert. Their deficit, though, is that they feel a lot of shame and they lack discretion, which is not something I spoke about, but a personality, if it's fully functioning, has a degree of discretion about, oh, I should behave like this in this context, and I should not behave like this in this other context. And that's why these patterns can be so destructive, is people walk into any context and behave in a very similar way. They use a lot of emotional blackmail, quote unquote. Narcissistic, finishing up the cluster B disorders. This is an interesting one. It's a pattern of grandiosity and a need for attention. It also includes a distinct lack of empathy. A person with a narcissistic organization in their psychology wants to be the most special person in the room, right? And it's interesting because there can be different ways to achieve that, including, by the way, being the most untreatable, mentally unhealthy person that you as a therapist have ever met, and attaining a kind of specialness through different types of behaviors. Their view of the world, unfortunately, is that the world is there to serve them. So they can be very hurtful to others, and they see others generally as inferior. Inferior sort of underlings might be a way of thinking about it. So it's an entitled sort of special disorder. So that's a lot, isn't it? You know, we're 2/3 done. There's even more. There's another cluster. The third one is anxious. Types of personalities that are anxious, like avoidant. So by now, as you watch this, you should be thinking, what's the pattern? I'm listening for the pattern. The pattern here is social inhibition, feelings of inadequacy, and hypersensitivity to any kind of negative evaluation. So the worldview is, it's very scary out there. You know, the sort of fundamental viewpoint is to be fearful. And my view of myself would be that I'm incompetent and I can't really manage. So my strategy is to avoid, to step back. That's how I deal with the world. It makes sense, right? If I have strengths, they're to do with being humble, but going too far probably. Not a resilient group, all right? So really struggle with changing times, different types of social upheaval, unrest, economic downturns, everything like that is very, very difficult. And avoidance begets more avoidance. So the problem is sort of, you might think of it as just like hyper isolating. You might be thinking, wow, I haven't met too many clients like that. No, they're avoiding. They're avoiding being part of the system, being part of treatment. And so as we think about different types of personality disorders, that's an interesting piece, really, is like which ones are showing up and which ones are just really not part of the system. Still in cluster C, and we're nearly done with our list. Dependent, okay? Again, the pattern you're asking, it's a pattern of being very submissive. Sort of behaviors that one might label clingy, excessive need to be taken care of. And it makes you think, oh, I wonder what happened in childhood where they couldn't get out of that almost childlike way of being and become an adult. Who knows? But clearly something happened there. So their fundamental pattern is help seeking. Their view of the world is that it's just totally overwhelming. And so I need help with everything. My view of myself is I'm incompetent, and my view of you is you're really competent, so you need to help me. And that excessive neediness grates on people. Okay, so that's what I want you to be watching for. Each time we look at the pattern, the problem is it gets to other people. It upsets family members. It upsets spouses. It upsets friends, and it breaks those relationships apart. And essentially that's the problem. I once heard an expert speaking on personality disorders, and they said, listen, if the person were living on like a desert island, in a way it wouldn't really matter, because all their eccentricities and all their different types of unusual patterns just wouldn't affect anyone, because there would be nobody there. But of course, living in society, completely different to that. The last one is called obsessive compulsive personality disorder. And I want to just pause, because you might be thinking, oh, I think he's talking about OCD. And I'm not, although it's related. And by the way, you can have obsessive compulsive disorder and an obsessive compulsive personality. Interestingly, obsessive compulsive personality disorder is one of the most common, but people don't usually realize that, because this group of folks are not going to come forward for treatment very often, because their view of the world is that they have it down and everybody else doesn't. So an obsessive compulsive personality, a really good example of this is if you're planning a trip with a friend, right, and they're making lists, that's okay. But if they're making lists that say, I'm going to pick you up at 8:07, and at 8:10 we're going to be filling up with gas, and then at 8:12 we'll be putting ice in the cooler, and etc. And you start to feel like, oh, I feel like the fun is sort of ebbing away from this trip with this obsessive, compulsive attention to little details and timing, and that pattern wears people out, and that's the nature of this disorder. So what they do, and sometimes they do it inadvertently, is they try to control other people, and other people don't like it. So that's where that dissonance is. But they're incredibly conscientious, right? So if you remember the idea of the continua with the different personality traits, this is a great example. For conscientiousness, there'd be an extreme conscientiousness right on the end of that continuum. So that's our list. It's a very long list. It encompasses an enormous amount of different types of behaviors, symptoms, patterns of behavior, different types of deficits. The nature of personality disorders is a really, really wide one. Before we wrap up here, I want to mention a little bit about intervention. And one way of communicating with folks with personality disorders that's pretty useful is encompassed in what's called set communication. So this is from the book I Hate You, Don't Leave Me, which is a very famous book written in the late 80s about borderline personality disorder. And in there, the authors develop a communication protocol that's really nice, and because there's so many waves in the communication with folks, especially in cluster B, that it's nice to have a kind of protocol that you're sticking to. And the way to, and because there's always problems, there's always like crises, things going on, right? So the first thing to do is support. That's the S. And you essentially say things that indicate that you care, that you're there to support them, that you're a partner, and they always like that, right? So that's the first bit. The second part is that you empathize, and you say things like, oh, okay, so it sounds like this is happening and it's affecting you in this way. And I can hear this and I can see this and I understand what's going on. And they usually like that too. All right. Now the third bit, so that creates a good alliance generally. The third part of this communication protocol is the difficult bit, but it's very important, and it's the T, and it's called truth. And this is where you point out the pattern and why it isn't working. All right. So you might say something like, when you call 12 times and leave 12 voicemails, it makes the other person feel like not engaging with you. So that's the truth. But you don't hit them with it first. You build up with support and empathy statements first. Okay? And so this is the bit they won't like as much. But when they get into therapy, that's what's going to be happening. The therapist and the counselor, they're going to point out these destructive patterns so that they can start to counsel them how to break them. When you tell people to leave you alone, then they're often going to do just that, and then you're going to feel abandoned, which is how you feel right now. Right? And so these truth statements start to get the person to understand the patterns that they're creating in their behavior. All right, so how is it treated? Well, Because people with personality disorders have a lot of symptoms, it's very, very common that they'll be taking psychiatric medications. Could be on antidepressants, mood stabilizers, antipsychotics, and very commonly anti-anxiety. So look out for that. And it's not uncommon for someone with, let's say, borderline personality disorder to come into a crisis residence with a whole Ziploc bag full of medication, all mixed up and kind of a mess. The medication can be helpful. It takes care of and reduces symptoms, okay? But that's all it does. It does not address the root causes and very long-standing character traits that drive their personality. So the therapy of choice today is DBT, which I encourage you to look up. It stands for Dialectical Behavior Therapy. It was developed by a clinician named Marsha Linehan. And it's a kind of talk therapy when it's done according to the model. There's one-on-one therapy, there's group therapy, there's assignments, there's a lot of different types of activity. And what happens is people learn skills in 4 different areas. So they learn skills around mindfulness, they learn skills around interpersonal relationships, distress tolerance, and basically they're learning how to be around other people through building skills. And so that would be the therapy of choice. But people with personality disorders are going to be in all sorts of different types of therapy, including cognitive behavioral therapy. And again, the therapist will be looking at those behaviors and trying to guide the client into understanding how the behaviors cause destructive patterns in their life, especially relational. All right, so before we wrap up here, a quick note on you, assuming that you are some sort of mental health practitioner or similar, right? Working with people with personality disorders can be exhausting. The reason is simple. Their personality profile and yours are probably a little different, causing a kind of dissonance, a kind of incongruity that feels very difficult to work with. They're called disorders for a reason. They are disordered. They are outside of that neurotypical realm, and you feel it, okay? You feel the frustration, and so your self-care, your compassion fatigue plan, your understanding of how vicarious trauma affects you is going to be crucial for you to maintain your well-being, your own mental health, so that you can continue to be effective and be successful with these folks. In fact, your practices that keep you mentally healthy, physically healthy, stable in relationships, they need to be your pattern. So that's a sort of closing thought about all these patterns, is what are your patterns and how do you use them to keep you together so that you can help people with personality disorders. Thanks for watching. Thanks for taking the time to build your skills, increase your knowledge to help your clients with personality disorders. See you next time.